Hello, good afternoon everybody. On behalf of Institute of Biofield Science and Research Center, I welcome you to this new topic for you, and I also thank Patil Madam for inviting me here to present a new concept, a new scanning device for the health issues. So today's our topic is, so we'll go little fast also. Today's topic is Biofield Science. It's a very new topic all over the world. Most of the research is going on this topic, and probably in next 5 years you will have one person getting a Nobel Prize on this topic. So it is a very hot topic nowadays, and I'm very happy to see you all here to know what this subject is. Basically, it is a photography of human energy field. It's a new word for you. We'll see to it. It is from the Vedic Life Science. So it's very ancient science. It was practiced, according to my study, 3000 years back. So what is the importance? We will see at the end of this lecture. The word is Chhaya Prabha. It is from our own Vedic science. That is why I call Ayurveda is the fifth Veda. It is more effective as a preventive diagnostic tool. So we need to integrate the modern medical science and the ancient medical science, what is called as Vedic human anatomy. The word Chhaya Prabha is a very simple word. It is given in Charak Samhitha chapter number 7. So most of the Ayurvedic people know about this word. A Chhaya means a shadowed area represented by dark colors in our photographs. Location of imbalanced energy, location of disease, discomfort area of the body. Very simple. Patient will report to you because of this imbalanced energy. Prabha, bright area represented by lighter and brighter colors. Location of balanced energy, location of disease, comfort free area of the body. Everything is good and functional. So, let me ask you one question. How many of you know the word aura? Please raise your hands. Okay. I'm not surprised, because aura is not a scientific word at all. Because in Bombay we have Aura nightclub, we have Aura jewelry shop, we have Aura sari shop, and now we have some models from Hyundai, Aura model. But it is very popular, and I must warn you that there is a lot of deception going on under the name of aura. If you go to the internet, probably they will tell you, send your photograph and we will give you chakra analysis. Not possible at all. So you should know the warning sign also. Yes, we do see these pictures probably in everybody's house, and we don't give much importance, but Modi ji has talked about this, that there is some beautification behind the heads of our saint, our god, goddesses. It means that they have some extra perceptual power. They have some siddhi. And this is the way it was shown. And these are the pictures right from the 5th century. So this concept is not new. Then what is the Biofield Science? What is the definition? A human body generates electromagnetic field around it, which is called human energy field or a biofield, or as popularly known as aura. This is due to the biophoton emission. This occurs in an invisible spectrum of frequency beyond our sensory perception. We do talk about word vibration. Or this area has got a good vibration. I am feeling very much happy. I am feeling very lighted. But we do not see anything. But it still exists. Now the technology is to make it visual, to extract this invisible information in a visible format. So central theme of Biofield Science is to study, visualize and document this concept. For that we need a very special room, special camera, special software, where we take the photographs of the physical body, but we do not see physical body at all. We see the invisible spectrum of energy made visible due to the software. So all these spiritual leaders who have an extra perceptual power, who can predict about you if you stand in front of them, similar thing is done here. We will still go into deeper as we go ahead. So a small introduction of my institute. We are working on this energy field, human energy field, for last 11 years. Lot of data we have, lot of lectures and presentations, paper presentations. But what are our aims? Very interesting to read this. IBERC has attempted to present a conceptual bridge between the current modern medicine and future subtle energy medicine. The Biofield scan is really the missing link between microbiology and physical medicine and psychotherapy. What is needed is a marriage of MRI, CT, Biofield scanning system to make it possible to go beyond the present resonance technology to look even deeper into the subtle energetic makeup of human body or human being. We see only our physical body and we have concluded that this is the only body I am supposed to take care of. No, we have one more body which we do not see. That is why we have called it invisible body. Sukshma Sharir. This concept is from Vedic period. Must be around 20,000 years back. So we need to accept that there is an energy body with us. Lot of research, lot of documentations has taken place, but I am sorry we cannot take that into the small lectures, but maybe I'll come back and give this for a longer time. So, to brief, introduction to ancient medicine and treatment planning from our own Vedic Life Science. To present documentary evidence of subtle body which we do not see, which we do not perceive, as per the Vedic human anatomy and physiology. So there is a modern anatomy and there is a Vedic anatomy. We have to study both. To understand Ayurveda, homeopathy, naturopathy and other energy medicine systems for integrated approach for diagnosing and treatment some of the difficult cases. No pathy is 100% perfect. We have to take best of every pathy and give a, what I call it, holistic healing to every patient. We just can't ignore that, no, this is not my field or this is not what I perceive, so maybe I am not giving you any help. There are many clinical diagnostic tests available in the modern medical science, also in these hospitals. But Chhaya Prabha, a branch of traditional Ayurveda, biofield photography, is more conclusive technique for preventive diagnosis. Believe me, we have some spiritual leaders who will predict your future illness just by looking at you. Now what they are perceiving is, they are perceiving our energy body, not the physical body. Showing invisible human energy field more easily and more often for study purpose help instantly to accept biofield science in scientific and intellectual community. Most of the people think that the body which is not seen, I am not aware of it and I don't want to study. This will not do. These are my all international paper presentations. These are my lectures in Ayurvedic colleges because this subject is from Ayurveda. Some of the lectures have taken place in the hospitals also. This is our head office, Sanatan Ashram, Goa. These are some of the very big gathering of spiritual people. And to promote this, to make people know there is another body associated with this physical body, we are conducting courses, 2-day courses also. Let us see how we can work out, which is called Know Your Invisible Body. We give you a documentary proof of your invisible body. And if we see these images of your invisible body, we will predict some of the things which probably you don't know about yourself. So much science has progressed. Our ancient science was so much predictive, so much perfect, in which we take this concept with proof of physical body and subtle body, the biofield scanning technology and interpretation of biofield scan, a first step. And then probably we have, and for these courses we have people across the society. Then we have advanced course, because this subject is so vast that you cannot learn in 2 days workshop. So we need to take you through the 2 months, probably 8 offline sessions. And I have 3 PhD students right now who are working on this field, and they are also presenting some papers. Because of the 2200 plus scans which I have got from the patients, there is a huge data. And when I compared it with the modern medical science and the Vedic science, it matched very well. And that is how I got the patent on this technology, the protocol through which we can accurately pick up the information from the invisible body, Sukshma Sharir. Yes, we have the software for this, and what that software will do, it will take a picture of your physical body, but it will show your energy body. You will not see the color, you will not see any anatomical landmarks in the energy body. What we are able to see? We will see the outer energy layers, which is called Urja Valay or Kanti Valay. I call it sometimes outer aura. It's your biofield again. 7 chakras and their current energy status, 14 main meridians and energy blockages if any, and therapeutic success from any treatment method. You use any pathi, the first change occurs in the energy body first. In 1949, the Kirlian photography was introduced, and it proved that any disease, any discomfort will be always present in the energy body first, and then it will percolate to the physical body. This is because your energy body is a template for your physical body. Your physical body is inactive without the energy body. So this is a new concept for you, but there is a lot of documentation. So what we are able to see is the ancient Vedic Vijnan, the chakras, the outer Urja Valay and these meridians. Mind you, these are not present in the physical body, so don't try to see them in your dissection classes. This I am showing you is an overactive heart chakra. It is not present in the physical body. It is only can be documented through this technology. And if this person does a meditation for 15 minutes, I can see this chakra getting balanced. We can predict the stress factor, stress hormone release by doing these scans. Most of the people think they don't have any stress. Obviously, a 12-year boy will say, no, I have no tension. But we can document it, and if you give the proper treatment, it could be a supportive from allopathy, from homeopathy, from Ayurveda. He gets the benefit. These are some of the traumatic cases which usually land in cancerous growth, because there is a hormonal disturbances first. These are not aura pictures. They are graphics. And these images circulate more often on the internet and also probably on the mobiles. They are graphics. You cannot give the interpretation after seeing these chakra images. So you have to be careful about the word aura. Basically, this subject is from our ancient Vedic literature. More so, the Panchakosh Siddhanta, which is the main component of invisible body that influences the behavior of physical body. And this is not my research. This is already given in the books. I am just trying to reintroduce this concept, which is so true, which is so unique, that we have cured most of the cases who have come to us for the scan after probably failure from other pathis. And yes, I always say we have a very less percentage of people who do research. But these are the people from Western world maybe MSc biochemistry, maybe PhD in physics, maybe PhD in microbiology. They thought something else about this physical body. And at one time, probably 75 years ago from today, it was called pseudoscience. People were not accepting this. But now it is proved a super science. Whereas in India, we have just started to introduce this subject. So we have a long way to go. Of course, Dr. Chintamani has written an article in this Surgical Oncology, Integrative Oncology, of finding an Indian solution to the universal problem for holistic cancer cure. He has said that my dosage of chemotherapy agent has reduced because of the integration approach from the alternative therapies, which is a very good point for us. And as you go deeper into this subject, we have to know the keywords: subtle body, 7 major energy zones, 72,000 nadis or meridians, of which 14 major meridians are now documented. A Panchakosha study where we have accepted the rebirth concept. So obviously, we have memories from our past lives. It's a little diversification, I would say, but we take birth to accomplish, to finish some of our unfinished agenda. And that is why we think, I am so honest, I am so sincere, yet I am getting all the blockages, I am getting all the unpleasant events. So that's a different aspect, that yes, we do take a birth to finish some unfinished agenda. We have some relationship issues from the last life. Okay, that's a pure Vedic Vidyan, but we have to integrate at one point. Then Biofield Science, the human energy field, quantum physics, biophoton emissions. We are constantly exchanging our information with the cosmic energy, with the Vaishvik Urja. And these biophotons, which we are emitting all the time, day and night, if they are captured through a proper technology, we will come to know what is happening inside the body from 8 feet. We do this photography from the 8 feet of that person because he has his own field which we do not want to intersect. Yes, so we need to, I want to give you a brief terminology introduction to this Vedic human anatomy. So what is the function of this energy body? Isn't this physical body is complete, very beautiful, very intelligent? No. It is the energy body which acts as a template on which this physical body grows. Our physical body grows over the template of energy or subtle body. A much deeper concept, but I just want to introduce some of the things. It is responsible for our own mental and emotional makeup because we carry information from our last lives. So many last lives, not one. The subtle body is always in contact with the cosmic energy or universal consciousness. Sometimes, for some people, get some dreams and within few weeks, months, they come true. So something has been given to you, additional information which is going to happen after some period of time. Then there is a study of Panchakosha, which is very important. The modern medicine has not studied this concept, but if we integrate this study with the present illness, discomfort of the today's patient, we will have a better understanding for holistic healing. Yes, we know the physical body which we see, and we know enough information about this. But there is invisible body. The first component is Pranamaya Kosh or astral body, which has got its own chakras and meridians, and this energy is supplied to the physical body so that all our sensory organs work properly. It runs our physical body. Then there is a mental body, which is our mental makeup of this life. Some people are scared of water, some people are scared of darkness. Some events have happened with us in the past lives. That memory, that stamps, we carry all our life. That is what the Vedic science says. I am not saying that. Then we have a wisdom or intellect body. Whatever we have studied in our past lives, they are our trump card in this our life. I have many examples, clips. You also see some of on the WhatsApp where maybe a 3-year-old child giving a stage show on tabla vadan. No, he did not have any master or classes in this life. This is called our information, our study from the past life which is with us. And of course there is the Anandamay Kosh, which predicts the quality of life in this birth, whether it's going to be a struggleful or whether it's going to be very smooth. Again, a deeper study for that. So we have seen this definition of Biofield Science. We will go into the components of Biofield Science. Biofield, it's an electromagnetic field around us, which sometimes called vibrations. We instantly like some people, we instantly dislike some people, because the frequencies do not match. The energies do not match. Energy zones, chakras and meridians, they are the network between the chakras. Chakra will absorb the cosmic energy, but it is distributed throughout the body to the cells, to the organs, to the glands, through this network which is called meridians. Yes, this is the right picture of biofield around us. It's like a football around us. We are inside that football. So anybody encroaches upon this, the feeling will be created by this person, which we call good or bad vibrations. And it's a very unique, like your thumb impression. I have about 65,000 to 85,000 scans. Only probably 10 scans will be similar to each other because they are from the same families. They have some They have same issues due to their past life issues. We call it Pitru dosh, we call it Graha dosh. So biofield means electromagnetic field. That is why the biofield is a more scientific word than the aura. And yes, we are using this concept in ECG and EEG. Though we do not know anything about the subtle body, what these electrodes are picking up? The magnetic field. Only the software will give you in a graphic mode. Each cell has a minus 70 millivolt voltage and it produces the energy for its own function. Then we come to the second point, that is energy zones or chakras. In Western world, chakras is not popular, but the energy zones, because they work like a transformer. If this area has a big colony has a one transformer, and if that gets blown out, all our electricity of this colony will go away. Similarly, these chakras influence the working of organs, cells and glands under their control, and it is very rightly pictured by our ancient science. So we have 7 chakras controlling all our physical body. So when we want to treat a physical body, the diagnosed and undiagnosed acute or chronic issues, we need to get this information integrated so that we can go to the root cause of that illness, and we can cure that. So they have a different frequencies, and they are the factors which exchange the energy. They take the fresh energy from the cosmic and they resend back the used energy. I will show you one graphic. No, I think we are short of time. Let's go ahead. So this is the clairvoyants who can see the invisible body by looking at you. They have said that yes, there are chakras. If they are balanced, you have no symptoms. If they are imbalanced, you complain of some symptoms. All these chakras have responsibility of working of some glands or organs, and we see these chakras in our biofield scan. This is the heart chakra, throat chakra, the brow chakra, the outer crown chakra, which is our urja valay, tejo valay, kanti valay. It predicts the life's quality of this birth. And when we see these disturbed, imbalanced, blocked chakras, we can predict the illness associated with that chakras. Very clear and very indicative. So we have sacral chakra, we'll talk about these illnesses. We have the solar plexus, solar chakra, we can think about these possibilities. Heart chakra, it's all about heart, thymus gland and lungs. Throat chakra, your thyroid issues. But there are some emotional issues also associated with that, which gives the additional information from the biofield scan. Then your bro chakras, most of the time you do get insomnia because you are worried, you are tense. Your bro chakra gets imbalanced and that night you do not sleep well. So all our physical body responds to the input from the invisible body. And this is the crown chakra where we have lot of cerebral issues. So this is our MRI of the energy, MRI of brain. Then meridians, as I told you, they are the connecting river between the chakras. We have 7 major chakras, but we have 350 sub-chakras all over body. So they all need to be connected. And the meridians do that job very subtly. And yes, we have science developed and we do get the benefit of these treatments also, especially the stiffness of the particular part. We call it frozen shoulder, you can say a knee pain or any stiffness around the pelvic muscles. The acupressure, what it does, it just releases the blocked energy. And within 10 minutes the patient finds the difference. So we need to think about this also when we want to treat the patient. All these names are there in the Charak Samhitha. And very important thing to note that the study of meridians, if you do it properly, we will know the science behind our traditions, rituals, beliefs. Why particular puja is done this way, why particular ornaments are worn that way. Because they are the modifying points of those meridians. Yes, we do see these meridians in our scans and predict the issues, mostly mental and emotional. Yes, there are 14 meridians, so we see the 14 meridians. Now then what is the biofield scan? The definition of biofield scan. Again, biofield scan means visualization of the invisible electromagnetic field. Then the energy zones, the chakras I mentioned, meridians, and of course the Panchakosha altogether. Of course, it's a very deep study, needs lot of books to read. So we are doing that at our center. Then how do we interpret the biofield scan, the invisible body in front of you, the images of invisible body in front of you? Again, you go to the Charak Samhitha, they have said that look for these signs, look for these colors, you will be able to predict. So our ancient scholars have done all the study, we have to just follow it. Now, how is it possible? You must be wondering, how is it possible to see invisible body? Yes, we do take the help of quantum physics. Quantum physics is beyond the rigid Newtonian physics. So, in 1941, Alexander Burwitch discovered these biophotons in his experiment, and then he concluded that biophotons are always emitted before every biochemical reaction happening within our body. Even if I'm thinking, even if I'm hot-tempered right now, the biophoton release will be different. If that is captured, we can predict about that person. The emission of biophotons is an expression of the functional state of living organism. You don't have to say a word. We pick up your inner information. The measurement can be used to assess the health issues. This information from the biofield scan is useful to pick up the past, present and future health issues. During physical, emotional and mental issue and causative disturbances is always found in quality and quantity of biophoton emissions. So if they have a different wavelength, frequencies, we will pick up that information in different colors. And lastly, the cancer cells and healthy cells of the same type can be discriminated by typical differences in biophoton emissions. The emissions will have different frequencies, so our scan will show that in a different colors. Very easy to do the interpretation. Well, it needs a proper room, proper protocol, and then only you can get your scans of the invisible body. I can't do it in your house, I cannot do it in the public events. A person is standing here, there is a special full spectrum tube light, my camera is from 8 feet away, and we get all your inner information. Physical, mental, emotional as well as spiritual. And what is the process? It's a 3 hours fasting is required. You need your stomach empty. Otherwise we will see the energy of what you have taken. Food. Male patients scanned by the male technicians, female patients scanned by female technicians only. 30 to 40 images are recorded by rotating you in 360 degrees. Because we have to scan the football around you. Diagnostic information from your scan given immediately along the detailed debrief. Moment your image is saved, it is your report. We don't have to send anywhere. Treatment options suggested based on patient's willingness. What he prefers. All pathies have some plus points. You have to combine that properly. The whole process is completed in 45 minutes. So we have an appointment schedule of 1 hour for every patient. I told you, we see the outer aura, we see the chakras, meridians, and we predict about that person, which that person doesn't know by himself. Very safe for the ladies because we do not see the physical body at all. And that is why all over the world such type of scan centers have more female patients because of the emotional issues, mental issues. So just to summarize, silent features of Biofield scan. Biofield scan is a non-invasive, radiation-free, painless and cost-effective. Because we are photographing you from distance of 8 feet. Biofield scan provides immediate health assessment of your energy body, unlike medical tests which are available after a certain time of span. It is very big contribution in preventive medicines. We are able to predict your future health issues It has ability to detect disturbances in energy field prior to physical symptoms being manifested or detected, where medical science has not advanced to detect subtle energy level imbalances. Because we do not study the subtle body, so we do not have a scanning system. It has ability to detect and highlight areas of potential debility and warn the key person of any organization with immediate danger on health issues. So this is more for the corporate world. And it offers pre and post documentary evidences for alternative, preventive, curative remedies like the big branches from the alternative science. So that is why this is called a holistic approach. Yes, we need to scan the mind of the person, the soul of the person, which is possible in this technology. And then probably we can avoid more shocked events. So what are the unique advantage of Biofield scan? Painless, non-invasive, cost-effective, no contraindications, describes not only present pathology but also past event and future issues in physical, psychological, emotional and spiritual dimensions. No possibility of any side effects, no use of radioactive medicine, inside out scanning methodology. No outside energy is used to pick up the information. So it is usually gets unmodified and it's very true. Predictive about the future health issues, points to the root cause of health issue enabling effective remedies. Yes, it is part of holistic healing. We need the information of the whole body, not only of the physical body, but mental, emotional, spiritual aspect of that person. Very useful diagnostic tool for mental and emotional issues, seen more in ladies, and no expensive, specialized and expensive infrastructure required. It's a room with proper protocol and your camera and software. And why so? The researchers have established that emotions, beliefs, your expectation release neurotransmitters such as histamine, serotonin, norepinephrine, steroids and peptides, which are capable of altering energy status at the cellular level. And that is why we need to capture these biophotons properly. Main advantage of Biofield scan is that it can pick up minute energy disturbances before they have become full-blown physical diseases, hence it is predictive. The imbalanced energy has to be on the energy body, then only it will percolate and it will manifest in the physical body after a certain span of the time. And Vedic science predicts when we suffer from chronic, incurable and hereditary disorders as well as mental and emotional problems, many times medical reports are inconclusive because the root cause is not in the physical body but in an astral or invisible body. So we need to get the entire information of that person, physical, mental, emotional, so that we can get the root cause of it and then treat it accordingly. Yes, we have the most emotional impact, most emotional trauma, and then how the person goes into the depression. We can see the root cause without the patient telling us. These are some of the bachus who have had very bad pregnancy of their mothers, very, very traumatic events during the pregnancy of when this child was inside. So they have received the imbalanced energy from the mother, and these children are having lot of health issue. We have found that, and if we correct this, we will have a good end result. These are some of the 11-year, 12-year girls who have received traumas, and then there is a sudden change in behavior. We could go into the root cause. It's written here, but I think I'll skip it. We can pick up the right information. They don't need any test. Yes, immediately I got suspicious and asked the patient to open the mouth. There was a cancerous growth. So it's full body scanning system for physical, mental, emotional issues, which needs to be integrated with more specified investigations from the modern science. As I said, no pathy is 100% perfect. So I want to draw your attention that yes, there are technologies, there is a system which can give us the entire information of that patient. And yes, we use the anatomical landmarks or templates. When I am seeing the back of this, I must be aware of the organs also. Because if they are diseased, they will be, the emission of biophotons will be different. So it is very easy for the people who are already into the medical field. And then I have this MRI, I have the cardiac information, I have thyroid information, I have a fatty liver or very bad liver, varicose veins, renal issues, prostate, hernia, piles from the root chakra, vitamin D deficiency very rampant in India. We pick up this information from your full body scan, so that is 30 to 40 images. Infertility issues, having the normal medical reports, we conclude that no, there is an issue with the chakras. We need to correct these energies. Then we have IBS. Again, it is related to your stress, tension. Knee issues, asthma, the lung energy, the pre-diabetic detection. And the patient gets shocked that you please do the HbA1c and see your results. These are some of the cases where information from others' investigation is required. Having done all the medical tests, the information from the heart chakra was missing. And this is the cause of the breathlessness. Because the heart chakra controls the energy of lungs and heart. Depression cases, this is a 5 picture, but it also shows the round curvature. We also pick up the same way. Sciatica, we see the emission of biophotons where it is distress, and that is the point of a source of pain. Some of the cases which we predicted on 10 September 2017, and yes, the left side of the patient goes into paralysis. These are some of the cases which we did the scanning, and after the biopsy and the test after 8 days, the same thing was mentioned here. We pick up information of the left axillary node inflammation. That too from 8 feet, non-invasive. So this is the beauty of combining all knowledge together. This is the accident 2 years back, but due to the scan I could tell that you had some injury, trauma. Yes, doctor, I had. I said there is still energy, diseased energy, which can give you trouble after some time. So it's so predictive. And of course, today's modern life with junk food so frequently, we are doing more damage to our system. These are some of the, this is a lady having a very traumatic life, and we could tell her that yes, and what the patient has to do is, yes doctor, it is true. So we pick up all the mental and emotional traumas. Pre-diabetic case, this person was saying, doctor, nobody has a diabetes in my family. I said, you get your HbA1c done, it was 7. Mostly completely into the diabetic range. Some of the children, disturbed children I would call them. We can work on them and they can be alright within 1 week. Some of the patients who have come to us with full body checkup, investigations, but your problems is mental and emotional, they can be picked up by Biofield scan. Another predictive, we picked up this information 4 months before, and then on 27 October he calls me, doctor, I am in the hospital with my right leg on the traction. Because it is this diseased energy, imbalanced energy, which is going to damage your physical body. These are again cases of, lot of cases I have. This is one good aspect of lady scanning is the breast scanning. We have picked up the information and given them the right protocol, right directions. Some of the cases which we predict that yes, this could be the reason, and we ask them to do specific blood tests, they all come true, positive. Yes, we have got some mails from, email from hospital team that yes, we need to study this aspect also. And that is how things are working. A disturbed child, we could treat them in 2 weeks. The knee pain, we can remove the bad energy through Reiki, TENS or acupuncture. These are some of the cases which the big hospital have called us, that is everything over for the patient, but we could review these patients. There is a wound 20 years back, not healed, 3 successive grafting took place, but with the energy concept, we could cure that wound. This is the 5-year boy having a fracture for last 3 years. All attempts were done, but if you correct, provide the right energy, right frequency, you can get that bone properly healed. These are some of the worst cases of psoriasis, which doesn't respond to the medicine very fast. But if we work out with the energy therapy, we can have this. So conclusion is, chakras and energy body can be seen with the biofield scan. With the help of Vedic view of human body, the interpretation of the biofield scan becomes reliable, very authentic. The correlation between chakras and panchakoshas and that between chakras and specific disorders in the body help in reliable interpretation of biofield scan. The information you pick up is very accurate. Scan describes not only present pathology but help to predict future issues in physical, psychological, emotional dimensions which are not yet visible on the body. So you get very good alerts about your health issue from the scan. Scan detects mental, emotional and spiritual progress where modern medical science fails to do so. Biofield scan points out to root cause of health issue, enabling effective remedies. So that is called holistic healing. It's an ideal research tool now where you can pick up the information as per the Vedic human anatomy. We can document the cosmic energy that surrounds all living beings, the invisible cosmic energy. Yes, we have this tool for subtle energy biophysics academically. That means we can see what our five sensory organs do not pick up information, and we have pre and post improvement documentation, and it's going to be a global health diagnostic system very soon. We are working with the defense personnel who, after having very rigorous physical activity, they also suffer from heart attack, liver issues. So this scan is very helpful. And another sector which is looking for this is the insurance sector, where today's medical test will not suffice. They want to know your future health issues so that the premium can be fixed. So of course, health education, healthcare and life sciences, holistic healing centers will need this technology. Low cost, painless, radiation-free research tool for medical and clinical research programs. A suggested approach would be awareness of biofield scan diagnostic methodology to all of us, all the medical staff, medical and paramedical. Accreditation of selected staff members, taking consultation from IBERC for diagnosing difficult, undiagnosed, complicated cases, research collaboration on selected topics, evaluating efficiency of treatment path, tie up with the hospitals as a regular diagnostic center and establishing a fully functional biofield scan center within the hospital premises. So we get entire information of that patient. Yes, we do have the 2-day workshop to know this invisible body in very much detail, and that's the end of it. If you have any questions, I'm here for next.